Why do you want to be a dementia nurse?
My motivation to become a dementia nurse is deeply rooted in a desire to provide a specific kind of care that goes beyond medical treatment alone. During my clinical rotations, I had the opportunity to work in a memory care unit, and it was there that I truly understood the profound impact a nurse can have on a person living with dementia. I saw how conventional nursing approaches often fell short, and how a truly person-centered approach, one that focuses on validation, patience, and creative problem-solving, can make a world of difference. It was incredibly rewarding to see how something as simple as using a patient's favorite music to calm their agitation or validating their reality, rather than correcting it, could restore a sense of peace and dignity. I believe my strengths in empathy, communication, and resilience are a natural fit for this field. I am not only passionate about managing the complex clinical needs that often accompany dementia, but also about building trust and connection with patients and their families. This role is a unique blend of medical skill and compassionate human connection, and I am committed to continuous learning to stay updated on the latest evidence-based practices in dementia care. Ultimately, I want to be a dementia nurse because I am driven to be a consistent source of comfort, respect, and skilled care for individuals during a challenging and vulnerable time in their lives.
What do you think are the most important qualities for a dementia nurse?
I believe the most important qualities for a dementia nurse are patience, empathy, and resilience, all of which are interconnected and essential for providing effective and compassionate care. Patience is paramount because it allows a nurse to approach situations without frustration, understanding that a patient's behavior, whether it's agitation, repetition, or confusion, is a symptom of their disease, not a deliberate action. This quality enables me to remain calm and focused, which in turn helps de-escalate potential conflicts and maintain a safe, tranquil environment for the patient. Empathy is equally crucial, as it allows me to connect with the individual behind the diagnosis. By trying to understand their perspective and validating their feelings, even when their reality differs from my own, I can build a rapport based on trust and respect. This empathetic approach guides me in tailoring care to their unique needs and preferences, such as using reminiscence therapy or their favorite music to engage them positively. Lastly, resilience is vital for sustaining this level of care over the long term. The role can be emotionally and physically demanding, and witnessing the progression of dementia can be challenging. Resilience allows me to process these difficulties, maintain my own well-being, and continue providing high-quality care without experiencing burnout. These three qualities, patience, empathy, and resilience, form the core of what it means to be an effective and compassionate dementia nurse, enabling me to provide both skilled medical care and genuine human connection.
How do you stay up to date on best practices in dementia care?
To stay current with best practices in dementia care, I believe in a multifaceted approach that combines formal education with continuous personal research and professional networking. I actively follow reputable journals such as the Journal of Gerontological Nursing and Alzheimer's and Dementia, which provide the latest research findings and evidence-based interventions. I'm also committed to attending professional workshops, webinars, and conferences whenever possible. For instance, I recently participated in an online seminar on non-pharmacological interventions for behavioral symptoms in dementia, which provided me with new strategies for using music therapy and sensory engagement to reduce patient agitation. Beyond formal learning, I make a point to stay connected with professional organizations like the Alzheimer's Association and the American Geriatric Society. Their newsletters, online forums, and resources are invaluable for keeping me informed about new guidelines, policy changes, and emerging care standards. I also actively engage with colleagues and other healthcare professionals in my network to share experiences and discuss challenging cases, which helps me learn from their perspectives and apply diverse approaches to my own practice. This combination of structured learning, informal research, and collaborative discussion ensures that I not only stay up to date on the most current clinical knowledge, but also continuously refine my practical skills and approach to providing the highest standard of person-centered dementia care.
Tell me about your experience caring for people with dementia.
My experience caring for people with dementia began during my clinical rotations in a specialized memory care unit, and it has since become a focal point of my professional passion. During that time, I was responsible for a small group of residents with varying stages of cognitive decline, primarily from Alzheimer's and vascular dementia. I quickly learned that effective care goes far beyond just administering medication and monitoring vital signs. It is about understanding each person's unique history, and using that knowledge to build trust and provide individualized care. For example, I worked with a resident who would become agitated in the evenings. Instead of relying on medication, I discovered she loved knitting, so I engaged her with yarn and needles, which helped redirect her energy and calm her anxiety. I've also gained significant experience in communicating not only with patients but also with their families. I learned to be a compassionate liaison, providing them with honest updates while also offering emotional support and resources. I became skilled at recognizing and interpreting nonverbal cues, as many of my patients had difficulty with verbal communication. This experience has equipped me with a strong foundation in person-centered care, a skill set in de-escalating challenging behaviors, and a deep sense of empathy that I believe is critical for success in this specialized field. I am confident that this background has prepared me to provide the highest standard of care to your patients.
How do you handle a patient who is becoming agitated or aggressive?
Handling a patient who is becoming agitated or aggressive requires a calm, systematic, and person-centered approach. My primary goal in such a situation is to ensure the safety of the patient, other residents, and myself. The first step is to identify and address any immediate triggers. I would assess the environment for things like noise, discomfort, or overstimulation and try to eliminate them. It's crucial to approach the patient with a calm demeanor, using a gentle tone of voice and simple, clear language. I would avoid confronting them or raising my voice, as this can escalate the situation further. I would then use de-escalation techniques focused on validating their feelings without validating the aggressive behavior itself. I might say, "I can see you're upset," to acknowledge their emotions. Often, patients with dementia are trying to communicate a need they cannot express, such as pain, hunger, or fear. My role is to become a detective, looking for the underlying cause. Distraction is a very effective tool. I might try to redirect their attention to a pleasant activity they enjoy, like looking at a photo album or listening to music. If these methods are not successful and the patient's behavior escalates to a dangerous level, I would follow established safety protocols, which may involve seeking help from another team member to ensure everyone's safety. My experience has taught me that patience and empathy are the most powerful tools in these challenging moments, helping to de-escalate situations while maintaining the patient's dignity and trust.
Describe a time you had to deliver difficult news to a patient's family.
A challenging situation I encountered involved a patient who had been admitted with a severe and rapidly progressing illness. The patient's family, while aware of the seriousness of the condition, held a great deal of hope for a positive outcome, and my role was to explain that the patient's condition was deteriorating and that a significant change in the care plan was necessary. My first step was to find a private and quiet space where we could talk without interruptions. I made sure to invite all key family members so that the information could be shared with everyone at the same time. I began by clearly and compassionately outlining the patient's current status using simple, non-medical language, and I was careful to avoid jargon that could cause confusion. For example, instead of saying the patient's clinical picture is worsening, I explained that their body was no longer responding to the treatments as we had hoped. Throughout the conversation, I paused frequently to allow them to ask questions and process the information. I focused on listening to their concerns and validating their feelings of fear and sadness. My primary goal was not just to deliver the news, but to partner with them in making decisions about the patient's comfort and care moving forward. The family was upset, but they expressed gratitude for my honesty and the respectful manner in which I handled the conversation. This experience reinforced the importance of blending clinical information with sincere empathy and clear communication during difficult times.
How do you ensure a patient's dignity and privacy are maintained?
Ensuring a patient's dignity and privacy is a fundamental aspect of nursing care, and I approach it by prioritizing respect, communication, and patient autonomy. To me, this starts with simple, consistent actions that make a patient feel valued as an individual, not just a diagnosis. I always begin by introducing myself and explaining my role, and I make it a point to address the patient by their preferred name. Before any procedure or care, no matter how routine, I ask for their permission, explaining what I'm about to do and why. This small step gives them a sense of control and participation in their own care. When it comes to physical privacy, I am meticulous. I always close doors and pull curtains before any personal care, such as bathing, dressing, or changing dressings. I also ensure the patient's body is covered as much as possible, using blankets or towels, and I avoid unnecessary exposure. For private conversations or when discussing a sensitive topic, I find a quiet area away from other patients and staff. This demonstrates that their personal information is confidential and their comfort is my priority. I also believe that maintaining dignity involves respecting their personal choices, cultural beliefs, and emotional needs. This could mean allowing them to wear their own clothes instead of a hospital gown, accommodating dietary preferences, or simply taking the time to listen to their concerns. By treating each patient with respect and acknowledging their individuality, I can create an environment where they feel safe, respected, and in control of their own health journey.
What strategies do you use to communicate effectively with a patient who has difficulty speaking?
Effective communication with a patient who has difficulty speaking requires patience, creativity, and a focus on nonverbal cues. My primary strategy is to create a calm and unhurried environment, ensuring the patient doesn't feel pressured. I always start by introducing myself and explaining my purpose in a simple, clear manner. I speak slowly and use short, concise sentences, avoiding jargon and complex questions. Instead of open-ended questions like, "How are you feeling?" I use questions that can be answered with a nod, a shake of the head, or a single word, such as, "Are you in pain?" I also rely heavily on nonverbal communication. I maintain eye contact, use a gentle and reassuring tone, and pay close attention to the patient's body language and facial expressions. For some patients, I have found that visual aids are incredibly effective. This could be as simple as pointing to a body part to ask about pain or using a pain scale chart. For patients with a more consistent ability to write or type, I ensure they have access to a notepad or a communication device. The goal is to meet the patient where they are, adapting my methods to their unique communication abilities. By combining these verbal and nonverbal techniques, I can build a strong rapport and ensure that their needs, concerns, and preferences are understood, even when they cannot express them verbally. This approach not only ensures effective care, but also maintains the patient's dignity and reduces their frustration.
How do you approach pain assessment in a nonverbal patient with dementia?
Assessing pain in a nonverbal patient with dementia is a complex but crucial part of my care routine. Since they cannot articulate their discomfort, I rely on a multifaceted approach that involves keen observation of behavioral, physiological, and social cues. My first step is to recognize that pain is a real possibility, even without a verbal complaint. Instead of asking, "Are you in pain?" I look for changes in their baseline behavior. These changes can be subtle, such as increased restlessness, withdrawal from social interaction, or a change in their sleep patterns. I also pay close attention to nonverbal pain indicators. These can include facial expressions like grimacing or frowning, vocalization such as moaning or groaning, and protective body movements like guarding a certain area or an unwillingness to be touched. Physiologically, an increase in heart rate, respiratory rate, or blood pressure can be a strong indicator of discomfort. I use established pain assessment tools like the Pain Assessment in Advanced Dementia Scale, which helps me systematically evaluate these behaviors across 5 categories: breathing, negative vocalization, facial expression, body language, and consolability. Finally, I use a trial-and-error approach with pain management interventions. If I suspect a patient is in pain, I might administer a prescribed analgesic and then observe their behavior to see if the symptoms of agitation or discomfort subside. This process of careful observation, systematic assessment using validated tools, and thoughtful intervention ensures that even my nonverbal patients receive the same level of compassionate and effective pain management as those who can speak for themselves. This approach is rooted in the belief that all patients deserve to live without unnecessary pain.
Describe how you would set up a patient's room to minimize confusion and reduce the risk of falls.
Setting up a patient's room to minimize confusion and reduce the risk of falls is a critical aspect of providing safe, person-centered dementia care. I would begin by creating an environment that is both familiar and easily navigable. This means removing any unnecessary clutter, furniture, or throw rugs that could pose a tripping hazard. The walking path from the bed to the bathroom should be kept clear and unobstructed at all times. I would also ensure that the room is well lit, particularly in hallways and bathrooms, and that any potential sources of glare or harsh shadows are eliminated. as these can be disorienting for a patient with dementia. Using a nightlight or motion sensor light can be particularly helpful for nighttime safety. To reduce confusion, I would work to create an environment with a consistent and predictable layout. This includes placing frequently used items, such as a water cup, glasses, or a TV remote, in the same easy-to-reach location every day. Labeling drawers and cupboards with clear words or pictures can also help a patient locate their personal belongings and reduce frustration. I would also consider using contrasting colors for key features like door frames, grab bars, or toilet seats to help the patient distinguish them from the rest of the room. These thoughtful modifications, combined with regular safety checks, create a space that is not only physically safe but also emotionally calming, supporting the patient's independence and overall well-being.